Good morning, everyone, and welcome to this morning's seminar. I'd just like to take this opportunity to acknowledge the traditional custodians of the land, the Kulin Nation, and pay my respects to the elders, both past and present. It's really exciting to see so many people here this morning. We've got a really exciting forum for you this morning, looking at the issue of information and communication technology. We've been able to bring some national experts who are at the forefront of looking at the issue of alcohol and drug responses within the ICT space to really come and talk to you about their experiences, their expertise, what they found out and what the opportunities are moving forward. This forum's been put on as a joint forum between the Australian Drug Foundation and Turning Point Alcohol and Drug Centre. And it's a really exciting opportunity for us to think about how we move forward in this space and think about how we develop ICT responses to increase the response we can have to alcohol and drug issues in the community. As part of today's proceedings, two newsletters have been produced, which came out just at the end of last week. One, which is, I think everybody should have a copy, or we'll have a copy towards the end of the day. I think they're at the end of the room.
We don't have copies there, I don't think, but we can contact our office.
Okay, so if you contact the office, we'll be able to send them out to you, and they're available as PDFs as well. So we have one, which is the Prevention Research Quarterly, which I'll just be talking to briefly, which is just reviewing the evidence, and it's put together by Simone, Roger, Angela Harney and myself, looking at what the evidence is, what types of activities are currently going on in the area, what the opportunities are, and we've talked to a few key informants, many of them who are here today, to talk about what are the opportunities and the risks and how should we think about ICT moving forward, and particularly for different agencies, what are the challenges that people need to think about and how should they approach making sure that ICT is part of their standard delivery. The other paper is providing new options for improving wellbeing, and again this is just a discussion with key providers who are currently involved in ICT delivery across Australia, and again talking about their experiences and some examples of some really great innovation that's going on. So two great publications. Urge you to download them and read them and really speak to the issue that we're talking about today. So we have a very exciting program. We have 6 national speakers coming to talk to us around a range of issues. The speakers will be talking for about 15 minutes each. We'll make sure they keep to time. We're not going to have any questions directly afterwards. We're going to hold on to questions. We're going to let you think about them and make sure they're really sophisticated. And then after morning tea and the last of the speakers, we're going to have an open panel session with all the speakers, and you can think about how we might address those questions to the speakers at that point. So I ask you to hold on to questions till the end. I'm just going to start by just talking briefly about the issues paper that's, as I say, has just come out this month, reviewing the evidence. And really, everyone here will be aware of this coming to today's session, but the issue of ICT and the opportunities for ICT in Australian healthcare delivery is a really exciting point at the moment. In 2009, it was estimated over the quarter of the world's population used the internet, and around 5 billion people owned a mobile phone. And I think this is before the census on Wednesday, but over 65% of Australian households have internet access, and I'm sure that figure's increasing. And around 90% of 16 to 29-year-olds use the internet daily. On top of that, about a third of Australians have smartphone technology and use it regularly. So there's huge opportunities to think about how we access the population and how we increase the range of different types of interventions that we have to the population at large using these technologies. Oops, wrong way. So the aims of the paper, the research paper, was to summarise key findings of drug prevention research as it applies to ICT in reducing alcohol and the drug-related harms, and provide practical examples from the field and approaches to usefully inform the work of AOD clinicians and services. So in terms of reviewing the evidence, there's a lot of really great work going on, mainly in other fields of health, and just in recent times really expanding to the alcohol and drug field. So this just really summarises the different types of ICT approaches that are currently available. The bulk of them today have been sort of prevention-focused educational websites with online screening and assessment. And there's certainly lots of really fantastic sites out there, but I think one of the things that we need to try and do is, as many people will be aware when you Google alcohol and drugs on the internet, there's a whole range of sites come up that actually have very misleading information. And we need to make sure that we have really sort of high profile, credible information out there so that we make sure the population is really well versed in the issues to do with alcohol and drugs and the best responses to them. There's a whole range of moderated forums, and there's good evidence that moderated forums, can be really practical adjuncts to standard treatment and also really useful for the aftercare component of treatment delivery. But again, there's some risks there in terms of thinking about how those forums are moderated and what sort of information is shared within those forums. So there needs to be good thinking around how we make sure moderated forums are the most effective. In terms of self-directed therapy, there's some very good evidence, and Frances will talk about a lot of the work that she's been doing around the issue of alcohol and drugs in this space. And there's really good evidence for self-directed therapy, but I suppose what the evidence shows and what clients really ask for is to make sure that there's support alongside that self-directed therapy so that they're feeling connected and there's some sort of coaching or mentoring and support around the delivery of that self-directed therapy. And similarly with online counselling, really good evidence, and Simone will talk about a whole range of activities at Turning Point around online counselling, which has really opened up the idea of providing drug and alcohol treatment more broadly that overcomes structural barriers such as geographic location and issues of stigma and shame. But to date, the evidence of whether sort of online counselling is as effective as face-to-face counselling still needs to be established. In terms of SMS health promotion, there's some really good models out there in terms of SMS use within health services, anything from reminder appointments to actually having targeted health promotion and interventions. So there's a whole range of opportunities there, and to think about how we target that, and some evidence around smoking cessation and other areas of health where SMS has really been targeted to increase outcomes. In terms of smartphone applications, again, there's a whole range of different sort of applications, particularly around monitoring, the link between substance use and mood, and again, some really good sort of growing evidence in that field, but still lots of work to be done. And then finally, the issue of social media and networking for both, not just for clinicians, not for clients, but also for clinicians and the sector more broadly, and around consumer information sharing and promotions of services and programs. In terms of opportunities for the sector, I mean, there's huge potential for service providers in terms of providing cost-effective reach to a much greater population. As we know, only a very small percentage of people with alcohol and drug problems go anywhere near a treatment service. So there's a huge opportunity to think how we reach out and provide a whole range of different treatment approaches to people who are suffering with alcohol and drug problems, and we think about how we engage them in a whole range of bringing them in a step care way to treatment. In terms of ICT opportunities, the great thing about ICT, it can be anonymous, which means that people can look at accessing information and look at overcoming barriers such as stigma and shame in terms of dealing with the issues of alcohol and drugs, which can be very, as we know, stigmatising in the community. The other great thing about ICT at the moment is it's being accessed by previously underrepresented groups such as young people and women. So it provides, again, a huge opportunity to reach out to a much broader population. And the use of social media and networks to facilitate awareness of services. As we know, we live in a very fragmented service system, and it's, I think, in the online environment, it gives us an opportunity to coordinate the front end to let people know what's available and how they can access that in a much more holistic way. The other opportunities for the ICT is around countering misinformation and service gaps by providing really accurate and evidence-based alcohol and drug relevant information, and that speaks to a point I raised before in terms of there's a whole range of different advice out there. I was involved with Tony Jorm at the Origin Youth Health around developing parent guidelines, and part of that methodology was looking up a whole range of advice for parents that's available both in lay and scientific literature, which included available websites. And it's amazing when you go out there to see how many opposing views there are on what parents should do in terms of dealing with alcohol and drug issues in the family. Similarly, when we developed some practical guidelines, first aid strategies for alcohol and drug use. Again, when you go out into the sort of wider space, looking at what's available in a whole range of websites, what you find is this whole range of conflicting views about the way in which people should help and support people with alcohol and drug problems. So there's a huge opportunity for us to get out on the front foot and really put out some credible messages out there. There's also opportunities, obviously, for intervention and support, including new and difficult to reach populations, and the whole issue of interactivity, tailored content and feedback for consumers, including via wireless technologies, is a great opportunity. Whoops. In terms of potential issues, I think this whole issue of ill-informed sites and resources, we really need to sort of think about how we tackle that in a much more systematic way. We're often working in isolation, and I think we need to think as a consortium of people interested in this area how we actually come together and actually tackle this issue and have a consortium of players who think about making sure that there's evidence-based approaches out there and available to the public. In terms of social networking, online forums, they have incredibly powerful influence on social behaviour. But there's risk there in the messages they can convey, and we need to make sure when we have these forums that we're not out there to encourage harmful and excessive behaviour. So we need to think how we moderate those. And also, there's a huge challenge now in terms of the internet being a marketplace. You can get a lot of cheap things over the internet, and that includes cheap pharmaceuticals. And so we need to think about what our response needs to be in terms of helping the public think through that issue. As part of the research paper, we also looked at sort of getting information from key informants to sort of help people who think and services thinking about moving forward in terms of developing an ICT response for their organisation, to think about what are the key issues to actually consider when embarking on such an endeavour. And really the key points that came up were clearly defining project objectives and target population, reviewing the evidence and consulting with the target audience. Obviously, we have lots of great ideas, but we have to actually go out there and ask people who are going to use the service whether they'd actually use it and what, from their point of view, is the things that they're looking from such a service. Understanding the range of expertise required and consider external partnerships. I think many of the people here will talk about the level of expertise that's required to develop some of those responses, and I think it's really acknowledging the level of sophistication that's needed in terms of delivering, going from effective responses to actually putting that in an online space requires a lot of different expertise, and it's important really, I think, to partner with key providers who are really skilled in providing that. Really planning funds and resource for ongoing updates. One of the, I think, the challenges around developing an online presence is normally there's some money for a startup venture, so you start up with a website with a great idea. But as we know, that the area is constantly changing and being updated, and and there needs to be planning if we're going to put something out there, that there's mechanisms to update it on a regular basis and make sure it doesn't become obsolete really within 6 months. There's an issue of considering developing risk management strategies, and that relates to mediated forums, and if you're wanting feedback, making sure there's management around how you allow feedback to occur. And developing sort of both online and offline dissemination and marketing strategies. Just because you put it on the web and because it's widely available to anyone doesn't mean that anybody's going to find it. So it's really important to think about who's your target audience and how you're going to market that space to them. So in terms of future directions, and so I suppose where the paper concludes is around there's a need to really continue to increase efforts to develop and evaluate ICT-based interventions. There are lots of exciting things happening, but the evidence base around what works and what doesn't work is still developing, and there needs to be a considerable amount of effort around that to really think about what's evidence-based in this space. But ICT delivered programs, I think one of the goals is to think of them becoming an established step in healthcare and treatment responses, because I think they really provide an avenue for accessing and targeting hard-to-reach populations and giving us a broader scope of the range of responses we can have to alcohol and drug issues in the community.